Hello guys, welcome back to my channel. Today we're going to discuss the updates on coronavirus in part of the England where we live. Today is 12th of March 2020. The underlying issues that we are going to talk today about the coronavirus are coronavirus updates, government efforts towards providing health facilities, panic buying, and preventive measures to avoid coronavirus. Disclaimer. This video is for informational or educational purpose only. I am not a medical staff and all the given information reflects my own amateur understanding of the underlying issues. However, the video presents information from various online sources and is correct in general. You can and should always verify the information by yourself. You should consult a professional medical staff and obey the rules and policies of the concerned authority. Do not forget to subscribe to our channel by clicking on the subscription button and hit the bell icon to receive latest updates on my life in UK. Do comment if you like our video and do provide your feedback on this video as it will be going to help us to improve the channel. Coronavirus update, 12th March 2020. The number of confirmed coronavirus cases in the UK has now reached 596, after the biggest rise in the single day. Following the confirmation of 134 more cases today, the total number of people died due to coronavirus reached to 9. Most of them were in their 70s and 80s with their underlying health conditions. Health Secretary Matt Hancock said the peak of the UK outbreak will be expected in a matter of couple of months. The area where we live, the schools and colleges are still open, the university is open. If there are any coronavirus cases, these individuals are being asked to self-quarantine for 2 weeks minimum. And as we all know, the risk varies from person to person based on their age category. The government efforts towards providing health facilities. Here we can see the government has taken very serious steps to deal with the situation in the country. People are asked to self-quarantine in case they get sick and if they have any chance to catch the virus to avoid a widespread outbreak of the virus. The news confirmed today the 9 deaths due to coronavirus. Corona pandemic has created chaos across the country. But government has taken several steps to bring the people in a situation where to remove this chaotic situation from the public. Panic buying. The corona pandemic has created chaos across the country. Especially this chaos can be seen in consumers for daily purchase items. The consumers are panicking to buy all grocery items if in case there are lockdown situations. The shelf for sanitizers and the hand wash are hard hit and almost empty on every retail store. To control the panic buying, the stores are limiting purchase of item per customer. All such things are sold as 2 items per customer in a single transaction. There was a funny quote on WhatsApp, so I wanted to share it with you people. It was about like public message for panic buyers. To the people who have bought 27 bottles of the soap, leaving none on the shop shelf. For others, you do realize that to stop getting coronavirus, you need other people to wash their hands too. It's quite yeah, it's very much understandable that everybody should keep their hands clean. They should not sneeze in public areas. If they cough or sneeze, they use tissue paper for it, catch it and bin it kind of a policy. But it seems like people are really panicking and they are trying to grab every single item they can get from the shelf. The preventive measures. This information has been taken from the government website. It was, if I tell you here, it is a public health matters blog.gov.uk. And there is a complete 5-step program to five steps advice given to the people by the government to be followed in case if there is the outbreak of the coronavirus in the community. So the preventive measures to deal with the coronavirus are wash your hands frequently and catch cough and sneezes in a tissue. Be prepared to self-isolate. Plan ahead based on your situation. Use health services wisely. Stay up to date using trusted sources of information. When we say trusted sources of information, that means you try to use the website which are either on the NHS websites or the GOV government web pages. Wash your hands frequently and catch cough and sneeze in a tissue. That's the first step. So here we are just talking about that cleaning your hands properly. And try avoid touching the doorknobs in public areas and the staircases and the doors and every possible thing which can possibly have coronavirus on it. It's quite a worrying situation that the number of cases have been have risen to 596. It is almost 600. So it's best to avoid it. A simple and effective way to protect yourself from coronavirus is by making sure you wash your hands frequently with the soap and the water or a hand sanitizer if you are out and about. It is particularly important to wash your hands once you get home or arrive at work or before you prepare or eat food. Nowadays, government is also taking another effort to avoid the outbreak of coronavirus by stopping people going to the public gatherings. Be prepared to self-isolate. In case to stop the corona spread, government can announce the school closures if necessary. The students could be asked to use online resources or a Skype link to receive lectures from home in case of school university closures. NHS has announced emergency phone numbers to call if necessary. The government is actively working on the terms and conditions if the workers get quarantined and their salary handling issues. For example, the government has announced is that if the worker on FT, like fixed term contract based, they would be paid sick leave salary fully. The NHS shows concerns over the zero contract workers and believe that they could be hard hit from the self-quarantined situation. All the people are advised to plan ahead based on their situations, individual situations, you can say. There are a number of ways to slow down an infection or infectious disease or outbreak. Well-established tactics, including self-isolation, as mentioned above, as well as measures sometimes referred to as a social distancing, can help prevent from coronavirus attack. One example of the social distancing could be encouraging more working from home, for instance, or another option could involve urging people to continue to go to work or school as usual, but reduce social activity or non-essential travel. All that information is available on publichealthmatters.globe.gov.uk. If you want to go in detail to see what else the government is advising to the people, you can go to these websites. And it is also being told to the people that use health care services carefully. Like, for example, if a person is having a common cold or flu situation, they should avoid calling emergency phone lines to avoid keeping them busy, so it can cause danger to the other people who are really in need of emergency. Or you can say, if in coming weeks coronavirus is spreading in the community, this could mean that NHS is busier than usual. So it is important to think carefully about NHS services you use. We expect the majority of the people who catch COVID-19 will make a full recovery without medical attention. But if you are concerned because you believe you are at the greater risk or feel your symptoms are becoming more severe, contact NHS 111 or alternatively 999 in an emergency. Services like 999 or Accident and Emergency A&E from the NHS should only be used for genuine emergencies. Stay up to date using trusted sources of information. That is the most important thing. As I have also used all government sources for the information in these slides, the UK government and NHS will keep people informed of the new advice and the developments. Please check the following sources of advice frequently: UK coronavirus page, NHS coronavirus page, travel advice page, Public Health in England, and the Department of Health and Social Care. Thanks for listening all that. And I hope that this information which is provided in this video may help the people to avoid coronavirus. And stay safe. I wish you all be happy and safe in your life. Comment, like, and share video with your family, friends, and anyone interested in knowing about living in UK. Once again, the disclaimer: this video is created purely for informational and learning purpose, and I do not consider myself a medic staff. If you need legal advice, please consult with the medical staff, not the lawyer. The links are given in the description to show the data sources for this video. Thank you for listening to me and have a nice day. See you in the next video. Till then, take care. Bye.